Hi there. I just wanted to explain what EMDR therapy is. There is this misnomer that EMDR, which stands for eye movement desensitization and reprocessing, is just this technique that creates this sort of magic when eye movements are utilized, or another form of bilateral stimulation such as tapping or audio when eye movements can't be tolerated, is the only thing for EMDR. It's not. EMDR is actually a rich therapeutic modality that is evidence-based and used oftentimes for symptoms of PTSD or complex PTSD. It is broken into three main components that fits nicely under the triphasic model of therapy, which is the first component is really looking at what's the difficulty in current life that's connected to trauma and traumatic material memories, and how are we going to first stabilize the person and ensure that they can connect with positive affect, that they can state shift, that life is stable enough, that we've assessed for dissociation. And once we've done that, then we can move into processing. If we move too quickly into processing, we can actually throw off our clients. We can destabilize them. I've unfortunately have heard of cases like this where we are too quick to move to processing, and clients' symptoms further exacerbate because we haven't reached those procedural steps that I just mentioned, because people that have been through really difficult times often have a hard time connecting to positive affect. What does that mean? They have a hard time feeling okay. That is completely foreign. They have a hard time feeling safe enough. And so we really need to do that foundational work before we go into processing. Once processing is, once those procedural points are met, then we step into processing. And then after processing, we look at doing integration work. So the 8-phase model really fits nicely into that triphasic model that I just explained. And for folks out there that are interested in EMDR, please know that if your therapist isn't moving quickly into the processing, there's a reason. And please ask what procedural steps they're working on. I completely believe that therapists should talk about what they're doing and why they're doing it. And I hope this helps.